Good morning, everybody. This is Lewis coming to you live as we hijack my son's bedroom. We're coming to you live with another Dirty Beaker presentation. And today we'd like to talk about osteoarthritis. The reason that I'm going to talk about osteoarthritis is because I posted a personal video a couple of days ago, maybe a week ago. And in that video, I did some exercises that was pertaining to increasing hamstring strength, to increase speed, as well as to increase flexibility and hip and knee alignment. And in those videos, I did some jumps and I did some things that would also be helpful for people that may have mild to moderate arthritis. But I felt that it would probably be important today to add some context, because at the Dirty Beaker, we always like to add scientific context to the types of pathology that we experience. I've spoken a lot about COVID, but today I'm speaking more so in general about osteoarthritis, which also indirectly looks at what we need to do in preventative measures for COVID, because we have to be active, we have to get exercise, we have to get outside and get the sun. The sunshine in turn gives us vitamin D, which also feeds our bones to make them stronger and protect us against osteoarthritis. So in a sense, it's relative to a lot of the presentations that I've made about COVID, but all of the Dirty Beaker conversations will not be about COVID. It's more so about sound science that's getting down and dirty into some of the things that we need to do ourselves from contracting certain viruses and keeping ourselves healthy, in other words. So with that said, I want to go into osteoarthritis because I did broach upon that subject during those videos, and I want to go into more specifically in osteoarthritis why alignment is so important. A lot of times when you saw what I was doing on that video, on that personal video for speed and quickness, it was dealing with alignment. And alignment is very important in preventing osteoarthritis. And I'll get into some of that as I get into the pathology and into the anatomy of osteoarthritis. All right, so here we go. Osteoarthritis, you have osteo meaning bone, and you have arthritis meaning inflammation of the bone. And so in this case, the part of the bone is the articulate cartilage, and I have it in blue here. The articulate cartilage lines the bottoms of the bones and the bone surface so they smoothly go across each other. And so you can see the articulate cartilage here, articulate cartilage here. But the synovial joints, and that's the type of joint that we have in the knee, is very unique in that it also has some cartilage called menisci. And the menisci, there's two sides to it. There's the lateral side, the side facing away from the medial part of your body, which is the lateral side, that's the lateral meniscus. And then you have the medial meniscus, which is coming from the inner side. And here I have it here drawn out as the lateral meniscus, as this is a right leg. And then you have the medial meniscus, if this is the right leg as well. So you have the medial side, you have the lateral side. All right, so with that said, within the joint, you also have synovial space. And in the synovial space, it's covered by a synovial membrane. The synovial membrane is drawn out a little bit better on this side. So you have synovial membrane here. Here's the outer lining of the synovial membrane, and here's the inner lining of the synovial membrane. That's very important. You'll also have a fibrous capsule that will cover this, as I've drawn here, and then you'll have ligaments that join the bone from the top down to the bone with the bottom, so that you have that stability in your movement, because the bones are going back and forth based on muscle movement. Okay, with that said, you have the synovial membrane here. I mentioned the synovial membrane because it's very important to what we're going to talk about today in preventing osteoarthritis and how alignment plays a role in that. So when you look at the synovial membrane here, the synovial membrane has a blood supply. So here I've drawn in red artery, blood, oxygenated blood coming to the synovial membrane, and then you have the vein where that's the deoxygenated blood that goes back into circulation so that it can become reoxygenated again and pick up more nutrients so that it comes back through the arteries. So you also have nerve fibers that align the periosteum. That's the external portion of the bone, and the nerve fibers that also go to the synovial membrane. That's very important because that tells the body when there's some sort of an assault that has happened to that area, whether it's been trauma or whether there's been some sort of pathogen that has entered. You experience pain due to inflammation, or you experience pain due to the trauma to that location. So with that said, you have the macrophage, which also sits in the synovial membrane. And a macrophage is an immune cell. Macrophages are part of what we call a monocyte. The monocyte becomes macrophages within the tissues of the body. And they just hang out just in case there's something that comes in that needs to be removed. If there's some sort of damage or if there's some sort of pathology, macrophages hang out. And macrophages do two things. One, they can engulf the pathogen itself, but they can also send out signals to the rest of the body to stimulate what we call cytokines. And cytokines are immune responses to pathology in the body, which signal for white blood cells to come and signals for neutrophils to come in order to ward that pathology off. But sometimes the macrophages, when they begin to stimulate the body to create this immune response, that's great because it removes the body of the immune response, but it creates havoc within the body because it creates these reactive oxygen species within that area. And those reactive oxygen species wreak havoc. And some of the reactive oxygen species are proteases that neutrophils release inside the joint. And when that happens, the joint becomes problematic. The joint begins to deteriorate because the proteases begin to eat away at the lining of the articulate cartilage. And as you wear down your meniscus through lifelong use of your body or from injury, if you don't have meniscus and your articulate cartilage is reducing, then you begin to experience the pain and the immobility due to osteoarthritis. So that's what that is. So in order to prevent that, and I have to say one more thing. One is that there's something that can trigger the macrophages to stimulate these cytokines to come. The cytokines are interleukin 6, interleukin 1b, tumor necrosis factor alpha, and then once that happens, the macrophages can also stimulate VEGF, which is a response to make more vascular endothelial growth factors. It makes blood vessels come to the area, and when that happens, the blood vessels also stimulate what we call E-selectin. And E-selectin stimulates for your other immune cells to be trapped to the blood vessels, so it can come from the blood vessels and go into the synovial fluid. And those are neutrophils as well as T cells that will come there and to eliminate pathogens, but also, like I said, create proteases that damage the tissue inside as well. So, with that said, alignment comes to mind. And what I mean by that is that a malalignment of your body due to a sedentary life. If you're sitting too often, your glutes become less strong or they become weaker. Sometimes your adductor muscles become tighter. Sometimes when you're driving, you're going back and forth with the brake pedal or the clutch or the gas pedal. And your adductors, meaning you're adding back to the medial area, the adductor muscles bring your legs back in. They become shorter because they tighten, and your glutes become loose because you're sitting too much. And so when that happens, as your adductors become tighter, they begin to pull this muscle coming across your tibia toward your thigh, this muscle come across your tibia toward the thigh, and you have what you call valgus, and your legs become weaker due to that valgus motion. And what I mean by valgus, you can see it here, it's like knock knees. So some people are born with knock knees, and that creates some problems with arthritis because you have overwear on the medial portions of the meniscus, but you can also develop a sort of valgus sort of motion. Your knees may not be knock knee per se, but sometimes your actions become a knock knee action, a valgus action. Whereas if you ask somebody to take a squat and you go all the way down, and when you come all the way down and you come up, you should be even when you come up. But when you have valgus, you go down, and when someone asks you to come up, you bring your legs in like that in order to get up. So you're trying to get your strength from turning your legs inward. And that's bad because you put pressure on your internal menisci and your internal cartilage. So when that happens, you're stimulating the macrophages. And the macrophages create more interleukin-6, interleukin-1b, tumor necrosis factor alpha, also more neutrophils that create this protease in this region, and you begin to break down your articulate cartilage as you break down your meniscus. This can also happen, of course, through injuries. When you're playing a lot of sports, you can get hit in your injuries, you can get hit in your legs and create trauma. It can happen through lifelong activities, because one of the risk factors of osteoarthritis, of course, is age. One of the risk factors is sex, meaning women have more osteoarthritis than men often. They're at more or greater risk than men. And then you have weight. So another thing is when you become overweight, you put more pressure on your meniscus, and that creates problems that cause osteoarthritis. So I'll go into a bit of what we can do to reduce weight gain. Of course, move in order to prevent weight gain, but you also have to diet as well. I brought some sort of dietary recommendations along with this conversation today as well. So as I speak about alignment, so the take-home point is that you want to say and recommend that you do see your physician and you do see a physical therapist to find out where you may have a misalignment or malalignment, and then they can work on the specific areas to work on for that. Because what I just described with loosening of the gluteus muscles and the tightening of the adductor muscles deals only with valgus. And in osteoarthritis, 20% more of the cases of osteoarthritis do come from valgus type situations where you wear and tear of the medial meniscus and medial articulate cartilage. But there are situations where you have varus here, and with that you have some lateral damage to the articulate cartilage, lateral damage to the articulate menisci, and there are specific exercises that your physiotherapist or physical therapist would prescribe for you to get that alignment back again. So today I'm going to do more alignment exercises for the condition of valgus, because that's the most common situation that occurs with osteoarthritis. So right now I'm going to go into some of the stretches that I do for that. So if you have severe arthritis, you want to stay off of your legs as much as you can. But if you have mild to moderate to severe, or just moderate, you can do more of the closed chain. And when I say closed chain, meaning that your foot is touching the ground surface and your body is intact with the ground surface. If it's open chain, it's more where you're sitting down and your foot is not touching the ground surface. All right, so with these, I do just normal calf stretches, and I hope you can see it. I take my foot out here and I stretch that for 20 seconds, 3 times. And then I turn my foot inward this way. And I hope you can see it. I don't think you can see it there. So I'm going to take this back. So you take your foot back. So first you're going straight back and you're holding it for 20 seconds, getting that stretch, keeping your torso straight up here, keeping that leg all the way back. And then you're going to do that for 20 minutes. Keep your heel to the ground. And then from there, you'll shake it out. And then you'll turn your foot inward so that you get a dynamic stretch. So you're turning that foot inward that way a bit for 20 seconds. You hold that there. And then you're also going to stretch your soleus muscles. These are the muscles of the calf here. And you're going to just bend down like that, just keeping that knee aligned, and keep your heel to the floor and your knee aligned with your toe. So you're aligning there. So you get that in. And you do it on both legs. So that's a good stretch for that. The other stretch for the calves would be for you to, and this is more of an open chain stretch, where I use my rope, my jump rope here. So I'll sit down here, and I'm going to pull my toe forward, and then just bend over. You try to keep your back straight so you get more stretch in your hamstring and not so much stretch in your back. Because I can come all the way down if I want to, but if I come here, I get more stretch to the calf muscle, which connects to the femur as well as the tibia. So you get that cross stretching here, and you also stretch the hamstring, which also connects to the tibia and the femur. So you're getting a multiple stretch there, and you do that, you hold that for 20 seconds, and you do the other leg, of course, keep that even. Then also with while we're down here, when people have severe arthritis, sometimes their legs don't go all the way down to the floor. And if your legs don't go all the way down to the floor, that's poor mobility, and you can create less pain if you're allowed to give yourself more mobility. So here you want to push that leg down, and you want to hold it for 20 seconds, let it go, then hold it for 20 seconds. And each time it goes down a little bit further on a day-by-day basis, and to the point where your feet can, eventually your knees hit the surface of the floor just like they should. Additionally, you can, while you're down, you can do the calf stretch with your knee up here, and you're holding the toe out, and you're pulling down your toe and stretching the ham. You can take it back further and further as you go along. So that's a good stretch for that. Now, if you don't have a problem with a lot of mobility, if you have mild arthritis, you can also do a hip flexor stretch or an abductor muscle stretch by putting this knee over, putting this ankle over the knee and pulling this back, so you stretch that adductor muscle. So I can feel it in there, and it feels like it's stretching really good. But that's if you're at more like a mild level. That may hurt a bit if you're doing it from a standpoint of severe arthritis. Now, the next one that you want to do, okay, so I did everything on the floor there. There are exercises that you want to do for your alignment of your glutes and your hips and your knees. So here's a good one for valgus, where you're training your hips to align and your knee to align with your toe, and you're strengthening your hamstrings in the process of doing it, and you're also stretching that adductor muscle, stretching it outward. So here you're just simply keeping your body straight, parallel to the wall, and you're coming down, making sure that your knee is staying straight and is going not past your toe, but down and up, down and up. And as you can see a little bit better here, if I turn this way, you can see it. My knee is going toward my toe. So you're going down and up, down and up, down and up. And as you stand up straight while you do this, you will eventually feel your butt shaking. You'll feel shaking in this groin area here. I don't feel that anymore because I'm used to it and I know the exercise now. But you do it on both feet. And that's great for basics of aligning those hips and knees. So the other one that you do from there is another simple one, and it's coming here, and you're on one foot, and you're aligning your knee to your toe there, and you're coming down, just keeping your knee toward your toe, and up, and up. And so you can see it on this leg, maybe you can see it better here. Here, you're going down, making sure that body is parallel and that the knee is not going above, beyond the toe, but just coming down, a semi-squat. So you get that motion in there also. Then you also want, you strengthen the glutes also by doing the jumps that you saw me doing. And they're easy jumps. You don't want to do, these are for people that have mild to moderate arthritis, nothing severe. You don't like to do a lot of the closed chain type stuff with the jumps when you have severe arthritis because you don't want to put that pounding on the knees. But in this case, I do. In mild cases, you do it. If you don't have it at all, then you can do the jumps. And they're good for overall leg strength. They're good for your calves. They're good for your quads. They're good for your hams, your glutes, even your upper body and back because of the way that you're jumping. So here, you're keeping the knees aligned with your toes, and you're coming down, all the way down, you up, landing